Over many years of my practice, I have seen thousands of patients who came to me with complaints about knee pain. And you know what has always amazed me? How people often ignore the first signals from their body, hoping that everything will pass on its own. Knee pain is not just a minor inconvenience, it is the language through which your body is trying to tell you something important. The knee joint is truly an amazing construction that withstands colossal loads daily, and when it starts to hurt, there's always a reason for it. Let's start with the most important thing, understanding what your knee represents. It is not just a hinge connecting the thigh and shin. It is a highly complex mechanism consisting of bones, cartilage, ligaments, tendons, and menisci that work in perfect harmony. When I explain this to my patients, I often compare the knee joint to a high-precision Swiss watch mechanism. If one part fails, the entire system starts to malfunction. That is precisely why it is so important to listen to what your knee is telling you. The first thing I always tell people suffering from knee pain is not to rush to swallow painkillers immediately. Yes, I understand that the pain can be unbearable, and the desire to get rid of it as quickly as possible is completely natural. But painkillers only mask the symptom without eliminating the cause. It is like covering the check engine light in your car with tape. The problem will not go away. It will just become invisible for a while. Instead, try to understand first what exactly is causing the pain. Does it occur after physical activity? Or perhaps you feel stiffness in the mornings? Or maybe the knee swells by the end of the day? One of the most common causes of knee pain that I encounter in my practice is joint overload. Modern humans lead a paradoxical lifestyle. We either move too little, spending hours at the computer, or suddenly decide to make up for lost time and start training as if tomorrow is the end of the world. Both are equally harmful to the knees. The joint needs regular but moderate load. When you sit still for a long time, the cartilage tissue does not receive sufficient nutrition, and it is nourished precisely through the movement of synovial fluid. And when you suddenly give excessive load, you risk injuring ligaments or damaging the menisci. I always recommend that my patients start with something simple: rest and cold. When the knee hurts, especially if the pain occurred after an injury or unusual load, give the joint a break. This does not mean you need to stop moving completely and lie on the couch for a week. No. Absolute immobility can even be harmful. We are talking about a reasonable reduction in load. Avoid prolonged walking. Do not climb stairs unless necessary. Do not stand on your feet for a long time. As for cold, applying ice in the first 48 hours after the pain appears can significantly reduce inflammation. Just remember, never apply ice directly to the skin. Always wrap it in a towel. 15 minutes of a cold compress every 3 to 4 hours, and you will notice how the swelling begins to subside. Now let's talk about weight. I know this is a delicate topic, but I would be a poor doctor if I bypassed it. Every extra kilogram of your weight creates additional load on the knee joints, and this load increases many times over when walking and climbing stairs. Imagine carrying a heavy backpack all day, every day, year after year. Your back and legs would get tired very quickly, right? The same thing happens to your knees. I have seen incredible transformation stories when patients, having lost just 5 to 7 kilograms, noted a significant reduction in knee pain. This is not a call for extreme diets. It is simply a fact of biomechanics. The muscles around the knee joint play the role of a natural corset, and strengthening them is one of the most effective ways to combat knee pain. The quadriceps, the four-headed thigh muscle, is your knee's main protector. When this muscle is strong and well developed, it takes on a significant part of the load that would otherwise fall on the joint. I often show my patients a simple exercise that can be performed even while lying in bed. Lie on your back, extend one leg, and bend the other at the knee. Now, slowly raise the straight leg to a height of about 30 centimeters from the floor and hold it in this position for 5 to 10 seconds. This simple isometric exercise works wonders without creating additional load on the affected joint. Flexibility is another key point that many people forget about. Stiff, inflexible muscles and tendons create improper load distribution on the knee, which leads to pain and increased cartilage wear. Stretching should become your daily ritual, like brushing your teeth. Pay special attention to the hamstring muscles and calf muscles. When these muscles are shortened and tight, they literally pull the knee into the wrong position. I recommend gentle, static stretching, where you hold each position for 30 seconds, breathing evenly and deeply. Never make sharp, bouncing movements. This can lead to microtraumas. Footwear is something we rarely pay attention to, but it has enormous significance for knee health. I have seen many cases where a simple shoe change led to a significant improvement in the patient's condition. High heels, worn-out sneakers, shoes without adequate cushioning, all of these are enemies of your knees. When you walk in the wrong shoes, the biomechanics of your gait change, and the knee begins to work in an unnatural mode. Pay attention to how the sole of your shoes wears out. If it is worn unevenly, this may indicate gait problems that will inevitably affect the knees. Sometimes it is worth consulting an orthopedic specialist for custom insoles. This is not a luxury, but a reasonable investment in the health of your joints. Nutrition plays a more important role in joint health than many people think. Cartilage tissue needs certain nutrients to maintain its structure and function. Omega-3 fatty acids, which are found in fatty fish, have a powerful anti-inflammatory effect. Vitamin D is necessary not only for bones, but also for cartilage health. Many of my patients are surprised when tests show vitamin D deficiency, especially those who live in regions with few sunny days. Collagen, which can be obtained both from food and as supplements, is the building material for cartilage tissue. I am not urging you to buy out the entire pharmacy, but a reasonable approach to nutrition can become an excellent addition to other treatment methods. Water is another underestimated factor. The synovial fluid that lubricates your knee joint is 98% water. When the body is dehydrated, this fluid becomes more viscous and performs its function less well. I always ask my patients how much water they drink per day and often receive uncertain silence in response. 1.5 to 2 liters of pure water per day is not a whim of nutritionists. It is a real need of your body, including your joints. Stress and emotional state also affect pain perception. This may seem strange, but I have repeatedly observed how patients noted increased knee pain during periods of heightened stress or anxiety. The fact is that chronic stress leads to increased levels of hormones that enhance inflammation in the body. Moreover, in a state of stress, we involuntarily tense our muscles, which creates additional load on the joints. Relaxation techniques, meditation, breathing exercises, all of this may seem far removed from orthopedics, but in fact plays an important role in a comprehensive approach to treating knee pain. When it comes to physical activity with knee pain, many go to extremes. Some completely stop any activity, fearing to aggravate the problem. Others heroically continue to train through pain, considering it a sign of willpower. Both approaches are wrong. Proper physical activity is the key to recovery, but it must be adequate to the condition of your knee. Swimming and water aerobics are practically ideal types of activity for people with knee problems. Water creates natural support, reducing the load on joints, while muscles get an excellent workout. A bicycle or stationary bike is also a wonderful option, but it is important to properly adjust the seat height. The knee at the lowest point of pedaling should be almost fully extended. Many people ask me about various ointments and creams for joints. I must say, honestly, most of them provide only temporary effect, if they provide any effect at all. The fact is that the knee joint is located quite deep under the skin, and active substances from the ointment simply cannot penetrate there in therapeutically significant concentrations. However, massage and rubbing in warming agents can provide relief by improving blood circulation and creating a distraction effect. If it helps you feel better and does not cause allergic reactions, then why not? Just do not place too much hope on these remedies. Sleep and recovery are the time when your body repairs damaged tissues. Make sure that your sleeping position does not create additional load on the knees. If you sleep on your side, try placing a pillow between your knees. This will help maintain the correct position of the hip and knee. If on your back, a small pillow under the knees can relieve tension. Sleep quality directly affects the level of inflammation in the body and your ability to cope with pain. It is important to understand when home methods are no longer sufficient and it is time to see a specialist. If knee pain is accompanied by pronounced swelling, redness, and fever, if you cannot put weight on your leg, if the knee gives way or locks, if the pain does not go away for several weeks, despite all your efforts, these are signals that cannot be ignored. Modern medicine has many diagnostic and treatment methods, from physical therapy and injections to minimally invasive surgical interventions. But the earlier you seek help, the more treatment options will be available and the better the prognosis will be. In conclusion, I want to say your knee does not hurt for no reason, and this pain deserves attention and respect. A comprehensive approach, including reasonable load, muscle strengthening, weight control, proper nutrition, and timely consultation with a specialist. This is the path to healthy knees. Take care of yourself and listen to your body.